Hello, my name is Emily Bossing, and throughout this semester I've been studying substance abuse amongst adults in rural Appalachia. This is a map of the United States in 2008 to 2014 showing the poisoning mortality rates per 100,000 people. In the area that is highlighted in orange is the Appalachian region. These maps were provided by the Appalachian Regional Commission doing a study focusing on poisoning rates. So this is zooming into the Appalachian region, and as you can see that this region is suffering more of the darker blues throughout the entire region, which means that they are having the higher mortality rates due to poisoning per 100,000 people. Focusing in on the problem, it's substance abuse in rural Appalachia. So from those maps, research has been conducted that drug overdoses due to poisoning, Appalachia is at a 37% higher rate than the national rate, and per 100,000 people, 35.9 people have died due to poisoning, including opioid overdoses, which is twice as much as the national rate. So how are these drugs getting out there? Why is it so prevalent in this area? Appalachia is a very rural region, and within rural regions, they have a lot of coal mining communities, which requires physical labor. And this is a community that prides themselves in blue-collared workers. So a lot of these physical laborers experience a lot of pain in their daily jobs, so they go to providers to receive painkillers, and the doctors in this region are overprescribing painkillers, which has higher chances that those painkillers are being distributed amongst families. Families are stealing them, selling them, getting them out in the community. In some counties, the OxyContin rates are 5 to 6 times higher than the rest of the region as a whole. So this is a very popular, sadly, topic due to all the opioids that are being prescribed, and people are dying because of that. So again, we see the Appalachian region. There are 24.9 million people living within this region, contains 13 states, and it totals to around 1,000 miles worth of area. So the key risk factors that are tied to substance abuse and addictive behaviors are currently on the screen, but the ones that are important for the Appalachian region is socioeconomic status, family substance use history, contextual factors, the availability/access to receive those, job status, individuals' living environment, their education, and life events. These risk factors tie into the social determinants of health, which we'll talk about on the next slide, and how these risk factors are affecting this area's top social determinants of health. This is another map that shows the region, and it shows the poverty rates amongst this region. And we can see that most of the region is in the darker colors, again, of the map key. The 5 social determinants of health that individuals in this population suffer are low-medium household income, household poverty, disabilities, lack of education, and their social associations. This community and population rely on their community to get them through their daily lives. So the key thing amongst this community, and if you ever want to work with them or develop an intervention, is establishing trust. They have a very hard time accepting outsiders into their community. Family is before everything in this population, and that includes education. So as long as food, shelter, and transportation for that breadwinner of the family to get to work are being provided in Appalachians' minds, that's the most important thing to survive. They do not stress education. There may not be enough money to provide education. And in this culture, that's totally normalized. This population looks at nice things. So having a nice house, having nice things in your house, having a nice car is looked at as showing off. Even how you pronounce Appalachia is how they look at you. If you pronounce it as Appalachia, they know you're an outsider and they can't trust you. But pronouncing it Appalachia, they will look at you like, hey, maybe we can trust them in those communities. So it's that small little pronunciation that can get you close and that they can trust you. And as you can see, there are obviously other factors done in a study by Russ that can help you build that trust within this community. So why this population? Why are they suffering from substance abuse? First off, they're rural. In rural areas, as you can see in this picture, Appalachia is a very mountainous region, which is not easy to get to certain things. So the accessibility to a provider to receive substance abuse treatment is slim. The accessibility to a regular doctor is slim because the numbers of provider in this area is very poor. This population, as we discussed, prides itself in self-resilience, and there's stigma attached to receiving help, let alone treatment for drugs. So that's three main things to consider when implementing an intervention in this population. The health inequities that individuals in Appalachia go through. First off, they have higher mortality rates in all the nation's 7 America's leading causes of death. They have lower supplies of healthcare professionals, especially mental health providers and specialty physicians, which we need for individuals wanting to get help with their substance abuse. And as we could see in the previous slides, their mortality due to poisoning rates is markedly higher in this region than the United States, and it's especially higher in the more rural and economically distressed areas within this region. Interventions that were implemented based on theory. The theory of reason action had telehealth and counseling, smart sobriety treatment and recovery programs. This wasn't a terrible, and these weren't terrible interventions that were implemented, but I believe if these two were combined, they would have had better results. Perceived threat. So within the Appalachian region, developed needle exchange programs in one county and drug drop-off boxes to dispose of extra drugs of any kind, no questions asked. This was the poorest intervention that was implemented. They had great results, but it was within one specific county. There has not been more research that shows it as more of a regional approach. The trans-theoretical model and precaution adoption process model, the peer recovery program wasn't terrible. The qualitative interviews that were done were amazing. They got great results from friends, family members that have either lost everything except their life due to substance abuse or have lost their life, but nothing was done with those interviews. No interventions were implemented. The social cognitive theory, we'll talk about more in the next slide, but it was the best theory that developed the best interventions for this specific population. Which leads to that the social cognitive theory is the best theory driven to implement an intervention for this population and for this issue. So we know that the social cognitive theory takes into effect personal factors and environmental influences that affects the individual's behavior. So in this situation, their behavior is we want them to go receive or go through some substance abuse treatment. And so the best way to do that would be a mobile phone-based life skills training in a faith-based setting. So in the research done by Russ, diving into this community and how to work with patients within this community, faith-based is huge. That community that they develop in their faith in churches, they all come together in those moments, and that is their community that they stick to. So if you're able to get access to go into their church and develop trust amongst those individuals, you're going to have the best impact in this community. Even in high poverty areas, everybody has access to a mobile phone. If an individual is suffering substance abuse and they do have access to that mobile phone, doing it within their own home provides them the less likelihood that they're self-pride is going to be damaged because of the stigma attached to getting help from an outsider. So having that mobile phone, doing it on their own time, increasing their life skills and their peer recovery, and connecting them to a peer recovery support program would be the most beneficial for this population. So things to consider due to working with clients of the Appalachian culture from Russ. The main things we already talked about. It's important of that small talk to gain trust. Explore the client's perception as an illness or sin. So do they view substance abuse as a true illness, or is it a sin? And is that why they're taking it harder to receive help? With the social cognitive theory, there's been so much research that I looked at with this theory is the higher the self-efficacy, the best results. And so boosting that confidence, boosting their self-efficacy will be the best way for these individuals to fully remain quit from any substance that they're using, and to have the best results in their peer recovery and support program. So possible concerns that may come up when implementing an intervention in this population. I made sure when considering all the research that was out there that the intervention was specifically chosen based on the area and culture, that they accommodated all the things that Appalachians would approve of. The community and culture is above everything else. We know that when discussing it through the slides. So when accommodating that and thinking about that, that would equal the best success for this population. We know that 3 and 4 would be gaining trust and time. If you do not have time or you do not have the patience to do those things, you will be viewed as an outsider in this population, and they will not trust you, and your intervention will fail. Thank you for your time and your consideration for listening. I hope this gave you an insight to this rural region of the United States. As I mentioned, if you have the time to watch the Oxiana documentary in the Hidden America documentary done by Diane Sawyer, I highly recommend it to get a great visual of this population and what they go through and their families' perspectives. Thank you for your time, and thank you for listening.